Thank you. Good morning, everybody. Can I just say that when you're standing at the front, there's incredibly bright lights in our eyes, but could I just ask you to say who you are? How many of you are actually home care providers? Right, okay, and home care commissioners? Right, and users of home care services, either yourself or for a family member? Can I just try that one again? One, good, two, great. Okay, that's kind of interesting, isn't it? But anyway, very warm welcome. Volume okay? Can I ask someone at the back to just confirm they can hear me okay? Great, thanks very much. Okay, I'm going to just very quickly introduce you to the United Kingdom Home Care Association in case you're not familiar with it. I'm going to give a few facts and figures which I suspect most people in the room will already know, but it's kind of setting the context. And then I'm going to talk about where I see the opportunities for home care in the years to come. And then I'm going to try and leave enough time at the end, because what would be really interesting is to hear some really good new ideas from you about where the opportunities are in home care. Okay, United Kingdom Home Care Association is the professional association for providers of home care services across the UK from whichever sector. So we have members from the local authorities, from the voluntary sector, from the not-for-profits, and indeed from the for-profits up to the biggest. We have about 33% of providers in membership across the UK. I explain our work as twofold. On the one hand, it's to encourage our members to continue to develop the quality of their services. In order to come into membership of the UKHCA, you have to sign up to a code of practice that requires you to behave at a higher level than CQC require. And the other side of our work is about influencing the operating environment. This is our vision and our mission. Our vision is of a United Kingdom where a choice of high quality, sustainable, community-based care is available to all. And as I say, our mission is around helping our members to develop the quality of their services and their sustainability so that people can continue to live at home and in their communities. A little bit about the current environment, which many of you will already be acutely aware of. The economic environment is inevitably leading to aggressive cost-cutting and price-fixing by some local authorities. And we heard recently a further £800 million is likely to be cut in local authorities. Reducing visit times, I'll come back to that, and new purchasing arrangements, which very often make delivery of high-quality home care even harder. And then for each organisation, there are internal challenges, recruiting, retaining and training the right workforce. If we've got time, we'll come back to that. National minimum wage compliance, a very hot topic at the moment. And ensuring that quality is both delivered and demonstrated. What we know from our research and from our membership is that there are kind of four key areas for this, and they came out in the recent CQC-themed inspection report. Concerns around missed or late visits. People like to know roughly when their carer is going to arrive, and they like them to do that. And there are issues around call cramming. I'm going to show you some horrifying figures shortly about short visits. But of course, I have actually heard somebody say, if the visit is 15 minutes long, you can do 4 of them in an hour. Takes a bit of working out, that one. Care worker continuity. People really need to know who it is who's coming into their home. The importance of, CQC picked up the importance of making sure that at very least people know if it's a new care worker and that they should indeed let them through the door. And the training for coordinators was another point they picked up. Quality monitoring, that was my point about not only delivering quality, but making sure that you can evidence the quality that you're delivering. And making it clear that you are listening to the users of your services and that you are recording their views and that you are acting on them. And then on staff training, the CQC report picks out particularly the importance of performance review and training and development plans for all of your staff. I said some horrifying figures. This was a very large survey that we ran last year, and we asked providers of home care, whether they were members or not, to tell us quite a lot about how they were working, particularly when they were, this is exclusively about services that are commissioned through local authorities or through the health service. These are not about private payers. But as you can see, a very clear message there that 73% of commissioned visits are for half an hour or less. And these will very often be to help an elderly, fairly frail person get up in the morning, get washed, get dressed, and have breakfast. I can't do that in 30 minutes, and I don't class myself in that group. So we said, what does that do? What's the impact of short visits? And this is what people told us. Now, we asked them, do you think the dignity or the safety of the people receiving services is at risk? Now, bear in mind, there will be a natural inclination not to say yes if you are a provider. So I think you can seriously take this as the absolute minimum level of concern. And in Northern Ireland, by the way, the 87% in Northern Ireland directly reflects that they have the very highest number of 15-minute visits. It's an absolute proportionate reflection. But England, you can see that 27% of providers think that people's dignity is being put at risk, and seriously, 6% think their safety is being put at risk. So we have this challenge of reconciling opposing forces, cost-focused commissioning practices for reasons that we understand, but they are cost-focused rather than quality-focused, and the increasing quality expectations. It's not a comfortable place to be right now, is it, if you're providing services for commissioned services for a local authority? So that's a kind of context of a lot of challenges. What I like about today's theme is that it's about opportunities. But I think I wasn't wishing to be Pollyanna-ish. I didn't want to suggest that where we are today there are masses of opportunities and just go out there and do them, because actually you've got to put it in the context of today. But I do hope that actually some of the ideas that I will come up with or that you will come up with from the floor will fire people with enthusiasm about working together to get it right. So, ironically, some opportunities in the demographics. 10.5 million adults with disabilities. By 2025, some 20% of the population will be over 65. Around 70% over 75 live with at least one serious long-term condition. By 2035, the over 85s may be 5% of the population. That means there are going to be a lot more people needing support, and what we know from the not conclusive but very impelling information is that more and more people are going to choose to stay at home and in their communities. So there is a challenge there. I'd like to see it as an opportunity, but it is a challenge to all of us to make sure that there is the right quality, the right flexibility of care available for all of us as we get older, or if we have disabilities and need support. There is also another challenge in there, of course, which is where is the workforce going to come from? So some real direct opportunities for home care. There will be a significant growth in personal budgets, direct payments and individual service funds. We know the trend towards personal budgets and direct payments, and there's been a piece of research just recently done through Think Local Act Personal into the effectiveness of personal budgets. And what they're finding is progressively personal budgets and direct payments are absolutely beginning to give greater satisfaction to older people. Initially, I expect you'll remember that actually younger disabled people grasped personal budgets and direct payments with both hands and found them really useful, and older people are a little bit cautious. But actually, the way in which they're being delivered now and the increase in the number of payments and the support that older people are getting, it's becoming much more the arrangement of choice for older people. So we need to be ready for that. There will be more self-funders. Still not, sadly. Well, no, the government has seen to that by... have we got any politicians here? By claiming, as the Minister did this morning, to have accepted... Sorry. The Minister claimed this morning that they'd accepted DILNOT's recommendations. Well, they kind of accepted DILNOT's recommendations by putting a cap, which is better than nothing. But if you remember, DILNOT suggested the cap should be 50,000 maximum, and the cap in 2016 will be 72,000. So actually, although it will benefit some people, there will be a lot more people who will actually end up paying for themselves throughout their need for care. Market position statements. Now, some of you will know that the Department of Health has commissioned the IPC to do an extensive piece of work with local authorities across England excuse me, to help them to prepare market position statements, which I think I'd probably call long-term strategies. So those market position statements will make clear for each local authority what their demographic projections are, what their values are in terms of commissioning, what they anticipate their needs are going to be in terms of commissioning services in the future. And that is a fundamentally useful piece of information for anybody wanting to develop home care services. My theme all the way through this is actually all these ideas will only work if people work together. Most importantly, if the people needing care in their families work with the providers and with the commissioning local authorities, it will not work otherwise. However, those market position statements should be really useful. I have just heard that actually not every local authority will necessarily be using the free consultancy from the IPC. Sorry, is this deafening people? The free consultancy from the IPC to make a full market position statement. It might just relate to a particular area of need, like, for instance, learning disability or physical disability. But there are, of course, other ways into that information. But we're hoping that in due course, every single local authority will have to make that information public so any providers can use it. Integration, actually the care bill in itself has massive opportunity in it in terms of helping people to stay at home and in their communities. And I think it's very much up to all of us to make that work in reality and not let the shortcuts happen. Integration, massive opportunities. You've heard the Minister this morning, or some of you will have done. His heart is absolutely in integration. Of course, he also is absolutely determined not to force anybody to do anything. So it will be a very long haul, but actually, if your concern is around helping people to stay in the community, then actually the integration opportunities are massive. You need to get talking to colleagues in health. The question earlier, the gentleman's gone, it was your question, wasn't it? The point earlier about CCGs. Absolutely, get in there, get talking to your local CCGs. because I would put money on the fact some of them don't even know what home care is, let alone who provides it in their area. Form links and partnerships. Now, links and partnerships within the sector, links and partnerships definitely with commissioners and CCGs, but actually think about links and partnerships with other organisations who specialise in a certain area. So, links and partnerships with organisations that specialise in dementia, for instance, or in end-of-life care, or in the things that actually is the day-to-day work of a home care provider. But make sure that absolutely you are expert in it and you are providing the very best care. And think about broadening the range of services. Now, some home care providers have already done this and some are just thinking about it. One of the things that I think we have to remember is that for many of us, actually asking for personal care is a very embarrassing thing to do. Asking for someone to come and help with the garden, help with the cleaning, maybe help with the cooking is very easy. And a lot of self-funders will probably move into personal care, getting personal care through those other challenges, through those other opportunities. So I know that some home care providers already offer kind of handy person services, gardening, cooking, dog walking, and so on. And think about that as a way not only of genuinely helping people stay in their community, but also as a feeder into personal care if that's your main business. Make sure you're ready for self-funders. Nikki touched on this a little earlier. For a number of home care providers who typically have only provided through a single contract with a single or two local authorities, it is quite a big change. It's definitely a change in terms of marketing, but it's a change in terms of some of the practicalities too, which is things like invoicing and so on. I hope it isn't a change, because when people are paying for themselves, you do what they really want and need, whereas if you're delivering a commissioned service, you do what you're told. I do know that there are some circumstances where providers do struggle with that, but I hope that actually every one of us is utterly committed to delivering services around the needs of the individual and the preferences of the individual. And the Minister, of course, has put into the care bill the aspirations of the individual, which is potentially fantastic if we can use it. ISF's individual service funds, if you look on our website, we co-sponsored a piece of research very recently into individual service funds. We really believe they should be used much more as a kind of halfway house between the local authority continuing to arrange the care and the individual who might not want to handle their own money. The individual service fund involves the provider, and I haven't got time to go in that in more detail, but if you're not clear about what they are, have a look on our website and look at the research that we've just published. I've talked about thinking outside the box. Look at the wider range of services. Look at linking up your services with other people's services, the whole person thing. The ultimate of that, of course, is the integration with health. Promote your business. I don't need to say anything about that, except to say all the stuff that Nikki said, but also don't forget to use the opportunity of the NHS Choices website, which is available to all of you. You will be, all registered home care providers are already on that site, but you have the opportunity to include more information about your services and to differentiate your services. And bear in mind that NHS Choices is the most visited website in the country. So really important stuff. Form your relationships with CCGs. That was before you asked the question. With CCGs, with voluntary organisations, with commissioners and with others. And then with that point at the bottom about always making sure that you're focusing on the individual's well-being and aspirations. And another thing the Care Bill does, of course, as the Minister was reminding us earlier, is it puts the the rights of the carer, the family carer, the informal carer, on a par with the rights of the person using the service. And I think it's really important that in delivering a service to the individual, we are also very much recognising that we're delivering a service to the family, and making sure that actually we're working with the informal carers as well as the individual. So, thank you for listening. That's how to get hold of us if you want to. We also have a stand just outside the door here with a couple of my colleagues there. So do go and talk to them about anything that interests you. We do have about 4 or 5 minutes for questions. Thank you. Do we have any questions?
Thank you very much, Bridget. My name is Joe Way. I'm with Country Court Care. We're a private provider of home care services. And of particular interest to me is your suggestion or recommendation that we start to make relationships or links with CCGs. But I feel certain, and I'm not the only one, who's kind of thinking, okay, so who do we go to in the CCGs? I don't know if UKHCA has any suggestions right now, because you see, with social services, we kind of are very clear who we're going to go to. When there were PCTs, we kind of knew who we wanted to go to. But with this CCG development now, there seems to be so much grey areas. And I don't know if the UKHCA has any suggestions or indeed any member of the panel. Thank you.
Thank you, Joe. It's a very good question. The problem at a national level around approaching the CCGs is that they are all at very, very different stages of development. And we as a professional association have looked very hard at how do we best influence and inform nationally the CCGs about the benefits of support in the community. And our advice has been quite strongly so far, and I think it makes sense, which is actually there isn't a lot you can do nationally right now because they are all at such different stages. What we are finding, though, is that at a local level, individual providers, home care providers, are managing to make links with their local CCG, 1 or 2 or 3 CCGs in their area, actually with some really quite beneficial results. I do think, as I said, I think for some CCGs there is a fundamental basic education job to do. This is whole new territory for GPs. Some of them are very excited about it, some of them less so. One of my colleagues recently went to his GP who asked what his job was, and when he said that, it was very clear the GP had no idea what home care was. So I think there's that very basic level of information that we can do on a national level at the right time. But I think anything more detailed than that, in the present situation for the next year or two until they've really bedded down, I think you're much more likely to have success at a local level. If you Google CCG, you'll know who your local people are. There is no single structure for a CCG. So I can't say, go to the administrator, go to the chief executive, go to the first name on the list, because in some cases either of those would be right and in some cases they'd be quite wrong. What I would say to turn this on its head is please, if you do have any success in getting through to your CCGs, tell us about it and tell us how you did it. Because what we will do is try and encourage people to follow the successful path in the future to make sure that CCGs actually do know genuinely what's available to their patients in the community. At the moment, I think it's one of the sort of scary areas because I'm not confident that they are up to speed with that. And indeed, any suggestions you have for us to do on a national level, let us know, particularly if you're members.
Can I add one thing? If you are interested in CCGs, our first session after the break is about GPs' understanding of home care, and I think that might be quite a useful eye-opener for a few people.
So we'll all be there, won't we?
Can we take one more question, please? I think there's a lady in the middle here. Yes, sorry, it's very hard for me to see you. There you are, yeah. I was actually going for the lady on the other side.
Can we do both?
We'll do both, yeah. Okay.
Find out about who the CCGs are. I don't know what it represents. The CCGs.
Clinical commissioning groups.
Okay,
clinical commissioning groups, it's the replacement for the PCTs in terms of commissioning of services in their area. It's a bit wider than that, but you'll get that in the session after lunch.
Hello, Beverly Young from Active Assistance. You've mentioned about CCGs, but you haven't mentioned about the CSUs. And in my experience, the continuing healthcare budget has all the commissioners are sitting within the CSUs at the moment as the interface for the CCGs. So I just wonder what your advice is around that.
It's possible that you know more about the detail of that than we do, but actually what I would say is the continuing healthcare budget is one of the real opportunities once the CSUs get their head around joined up thinking. It's still very health oriented, and I'm sure that the local authority reps present and indeed many of the home carers are well aware that reablement, for instance, is that area of home care support that a lot of local authorities have kept in-house when recognising the benefits of outsourcing all other aspects of home care. So there is a lot of work to do. I mean, I genuinely believe in the opportunities I've put up, but I wouldn't like anyone to think they're quick wins. I think CSUs, we perhaps need to spend a little more time looking at CSUs than we have done, to be honest, and the CCGs as well, because I think that's those relationships, building those relationships are what is going to change the world. I'm afraid it's not the minister standing up and saying it's a great idea. That helps, but it's the relationships at a local level that are going to change things for the individual.